Hello, everyone. My name is Eva Rout, and I'm currently a student at Denmark High School, and I'm beyond excited to be presenting at the Global Health Leaders Conference at Johns Hopkins University. Today, I'm going to be talking about the impact of technology usage on youth mental health. Now, before we dive into this topic, here's a little bit about me. I'm a rising senior from Forsyth County, and throughout high school, I've been passionate about technology, leadership, and also community service. So, first, I have served as co president of my school's Technology Student Association chapter, and I currently serve as officer and chapter mentor. I'm also the co founder of the Joy Project, which is a nonprofit that's focused on spreading mental health awareness among the youth. And I also conduct research at UNG regarding geospatial data analysis, and I'm working as a software engineering intern. Now, my long-term interests lie at the intersection of engineering and computer science, and also mental health, especially when exploring how artificial intelligence and problem-solving solutions can be used to support mental wellness and also just improve that human connection. Now, technology is a part of everything we do, from how we socialize to even how we learn. But with that constant connection comes growing concern, especially among teens and the youth. Youth mental health is a global health issue, and it's not limited to a certain country or region. Social media and smartphone usage have all contributed to rising rates of anxiety, depression, and even stress worldwide. That's why understanding global health is so important. It's about improving health outcomes for all people by addressing these shared challenges. I like to think of it as like these four pillars. So, first, we have health equity, which ensures that everyone has fair access to healthcare, collaboration, which is used to work across borders to solve problems, prevention strategies, which address issues before they start to grow, and sustainability, which builds just mindful solutions. And together, these principles help us create real and genuine change, especially among the youth. Now, did you know that nearly 1 in 3 teens reports feeling anxious or depressed as a result of social media use? What we see here in this image reflects that reality, just that constant exposure and comparison and digital pressure that surrounds young people. And this isn't just a mental health issue, though, it's a global health challenge, which causes us to become more aware of it. For example, according to a report by Pew Research and the CDC, depression among teens has increased by over 60% in the last decade, with teen girls especially being affected. This is important because mental health affects everything, such as academic performance and even social relationships long term. And when millions of young people are struggling, there is a call to a public health crisis. Now, teens today face a new kind of social pressure with platforms like Instagram, TikTok, and Snapchat creating environments where self worth is tied to things like views and filtered images. Now, this contributes to things like low self esteem, depression, and social anxiety, and just disconnecting from others. And this was specifically heightened during the COVID-19 crisis. A Penn State study found that social anxiety levels rose significantly during the pandemic, especially when students lost that face to face interactions with their peers. And I also want to touch on traumatic stress, which goes beyond social pressure, since teens exposed to online bullying or traumatic content can develop PTSD like symptoms, such as flashbacks and depressive episodes. This kind of stress can have long term impacts, especially when they go untreated. Now, I want to talk a little bit about the pros and cons of social media. I first do want to say that social media is not all negative. Social media can offer identity and connection and support from people around the world. But the cons are serious. So, for example, 46% of US teens face cyberbullying, which are often how they perceive themselves, is where that comes from. And over 55% of teens feel unhappy with their bodies due to filtered content and just unrealistic standards online. Now, as you can see, these headlines speak for themselves. Youth mental health is in crisis. From rising depression and suicide rates to 38% increase in antidepressant prescriptions among the youth, the numbers are truly just big and shocking. And COVID 19 only made things worse with 76% more cases related to anxiety in just 2020 alone. And news outlets like CNN and the New York Times have spotlighted this urgency and shown us how it's not just isolated, but it's also national and global, and it's something that we just can't ignore moving forward. Now, here are just some things that students are saying about their personal experience with mental health. First, a 12th grader shared that everyone is struggling, but no one knows how to speak up about it. And a 10th grader also said that we forget we have so much ahead of us, trying to remember that is hard. So, these are real, genuine thoughts from teens, and they highlight how much more work needs to be done in order to create that safe environment. To better understand how students are feeling, I also conducted a survey at Denmark High School. The results were very shocking indeed. Over 52% of students felt isolated and said that they had no one to talk to. And also, students said that their stress levels were rated from more of a moderate to high level. And these findings just show how students aren't just struggling, but they're silently struggling, which kind of shows the importance of prioritizing mental health support, especially in like standardized schools, not just outside. Now, let's also break down how technology plays a role in this. Social media and technology usage have increased dramatically, especially among teens, and this can lead to harmful effects like cyberbullying and poor sleep and low self esteem. And these issues don't just like work isolated, they build up upon each other and create this domino effect, which negatively impacts teen mental health. And in the end, it's the youth who kind of like pays the price for it. Now, as we reflect on all of this, it's important to realize how powerful technology is and the influence on youth mental health. Now is the time to really act after analyzing this data and research and hearing these personal stories. And it kind of shows how we need better education and more mental health resources within schools in order to like help with student well-being. And I do just kind of want to end this with a question for you all to think about, and that is, what if the next big technology innovation wasn't about going viral, but about helping someone else feel less alone? Now, here are just some of the resources I used for my research. And lastly like to say a huge thank you to the Global Health Leaders Conference at Johns Hopkins University for this opportunity, as well as my mentors, peers, and everyone just who inspired this project. And thank you to the audience for taking time to listen to me. And if any of this resonated with any of you, please feel free to connect to me. I hope you all have an amazing day.